Hey guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Escitalopram. Complicated name, but really it's Lexapro. Fancy stuff. It just went generic recently in the last couple of years. Very good medication. It's cousins with citalopram. So if you tried citalopram and you weren't getting the results you wanted, your doctor may have switched you on to escitalopram. Very good stuff. So let's get into it. What does it do? It is for general anxiety disorder and or depression. You can use it for either or. And then off-label, there's a lot of different uses for a whole bunch of stuff. Any kind of behavioral disorders, issues like that, you can use this medication for it and it'll help. And a lot of times they'll use it in conjunction with other medications that work in the brain and you get great results. Scientifically, it's an SSRI, selective serotonin reuptake inhibitor. Fancy words for just saying it increases serotonin in your brain. So when you have depression, it usually means that there's a chemical imbalance in your brain. You don't have enough of one thing or too much of something else. And so this kind of helps you level off and get to where you need to be. So people who generally are depressed don't have enough serotonin in their body. Serotonin is what gives you the feelings of happiness and fulfillment and things like that. So more serotonin, the happier you are, and then the less depressed you are. Simple stuff, right? You can take it with or without food, doesn't really matter. There's several ways to take it. Generally, you take it once in the morning. That's generally how I've always seen it. In very rare instances, you may take it twice a day, but again, that kind of really depends on your doctor. They can kind of dose it however they see fit. That's kind of how you see it. It generally kicks in about a week. You can kind of start to feel the effects. However, depending on your past history with depression, if you've been on other medications, maybe you've built a bit of a tolerance up for it or whatever, it could take up to 8 to 12 weeks to see the full effect, which is why you kind of have to just stick with it. I've talked about it in previous videos, but if you take drugs or alcohol, that's going to impair how this medication works, and thus all you're going to do is just kind of get in the way of this pill doing its job, and then we want the pill to do its job. So, avoid taking all these different drugs and alcohol or abusing alcohol while you're on this medication. It does go through your liver, so if you have any sort of hepatic issues, hepatic impairment, make sure your doctor is aware of that so that maybe we can kind of switch you on to something else or do whatever we can to kind of protect your liver from being more taxed than it already is. I'll put up a list of side effects right here. These are the most common. And then also at the same time, when you're on this medication, most doctors over time will put you on other depression medications as well. They'll kind of stack them so that you get the max benefit. There's a synergistic effect that can happen whenever you put the right drugs together. But one of the biggest caveats is these ones that are called MAO inhibitors. We're getting into the complicated stuff, I know, but briefly, just make sure that your doctor is well aware. Make sure you're going to one doctor, or if you're going to several doctors, everyone's on the same page about what you are taking so that they don't put you on this medication, because then you're going to get side effects and issues that happen. You generally need like a 14-day gap from when you stop this medication to when you can start an MAO, which is a different kind of medication for these same sort of issues. And then also just don't stop taking the medication one day. If you're having side effects, and the side effects are really the number one thing. If you get those like dull throbbing headaches that don't go away, you need to let your doctor know, but don't just stop the medication, because you have to wean off of it, because you'll have withdrawal symptoms. A lot of people usually associate withdrawal with like something with like a medication that's really, really bad or something. It's not. It's just the fact that this works in your brain. You have to treat it just a little bit differently. So if you just stop taking it, all of a sudden your body's used to you getting this much serotonin, and then the next day, if you just stop and then all of a sudden you have this much in there, it's going to throw your chemical balance off, and then you're going to feel the effects. So wean off slowly. Make sure you wean off, and you wean off this medication under the supervision of your doctor. That's the most important thing. I've had people call me and go, I just didn't feel good on it, and I just stopped at 3 months into it. They're like, I had some headaches, but I just dealt with it. Don't do that. That's dangerous to your body. And especially if you've had some really severe depression, you don't just want to stop, because there are things that can happen to you, which kind of gets into my next point. This has a black box warning, which is an FDA indicated warning for increased suicidal thoughts. That generally tends to happen. with depression medications. I know it kind of is counteractive because if you're on this medication, it should make you happier, you should be less suicidal, but it's something that in practice we've always kind of seen this kind of happen where it does lead to this as well. So just watch out for that. If you're starting to get these like increased suicidal thoughts, aggressive behavior, things like that, let your doctor know, because then we need to definitely switch you off this medication. It's not good for you, okay? Which is why also with depression, it's if you have clinical depression, it is a serious situation, and you need to also let people around you know about it so that they can let you know, hey, have you been on a new medication? Yes, I have. Well, you know, I think you're acting a certain way, because sometimes you don't know that you're acting weird until someone tells you, like, hey, you know, you've been a little extra agitated with everyone, or you've been a little angry, or your tone has been like this. Are you sure that's not the side effect of the medication? And so that's kind of like a safety check to have. I always let my patients know about that, because sometimes you can't fully trust, you think everything's normal when it's not. So I think that's it, guys. Again, depression is a very, very in-depth topic. We could go on for it for a very, very long time. I'm just giving you the 101s, the basics on Lexapro and Escitalopram. If you have detailed questions, please direct them to your doctor, your local pharmacist, or give us a call here at Telfair Specialty Pharmacy. We would love to kind of go through the ins and outs of how depression is and the things you can watch out for it, okay? Thanks for tuning in, guys. Please make sure to subscribe, leave comments below, what helps, what doesn't help, what would you like us to add in the videos moving forward, and it's all really just to help you guys, okay? We're that's what these videos serve. So, all right, guys, that's it. We'll see you next time on Meds Made Easy.